This is Coyote News.
Governor Kristi Noem says the sudden rise in COVID-19 cases across South Dakota is due to an increase in testing. However, researchers say that within the last 14 days, the state has seen one of the nation's highest virus positivity rates at 23%. This would mean that South Dakota has an even higher rate of infections than the sudden increase in tests indicates. 302 people are currently hospitalized across the state because of COVID. 61 of those are in intensive care. South Dakota's two largest hospitals in Sioux Falls have no general care hospital beds available and only have 41% of their intensive care units ready to handle severe COVID cases or any other form of medical care. The number of deaths currently sits at 288 statewide. Cases have started to rise at USD since starting random testing of both students and faculty. The total active cases among students is 49 as of this morning. Coyote News' Sierra Prue is live in the muck to learn the cause of the sudden spike in cases in the campus community. Sierra?
Thanks, Kyle. I'm here with Kevin O'Kelly, head of COVID case management here at USD. Kevin, thank you so much for being here with us today.
My pleasure.
Cases have began to rise here at the university. Have you and your COVID task force noticed any patterns involved in this rise and what potential sources there might be because of it?
Thank you for asking that question, Sierra. We have also noticed the rise in cases at USD. We've been actively looking at the individual cases, looking for patterns. A couple of things combined. We have a higher positive case rate in the state of South Dakota. We all know this. We don't live in an isolated bubble. We live in the state of South Dakota. So it's inevitable that the higher percentage rate in South Dakota is going to cause an increase in infection rates among our student population. That's going to happen. Secondly, we had D-Days, and we have a surge of cases 7 to 9 days after D-Days, as we hoped would not happen, but as did happen. So those two things combined to create this unwelcome increase in cases on campus.
And randomly issued COVID cases for students and faculty began in September. What observations has the COVID task force made because of those random tests? Have they helped? Have they not?
Well, we just started them in October, Sierra, so this is only our third week of them, so we don't have a lot of data yet. We're hoping to get 5% of our population tested monthly, but we're not achieving that goal yet. The imperative to get tested is often lost on people we randomly draw. They're not sick, they might not feel like they need to get tested, but we're encouraging them to get tested because the story is, if you're sick, if you're physically sick with COVID-19, you will get medical care. But half the people with COVID-19 are asymptomatic and yet infectious, and we're looking for that half of our population right now. So we don't have solid results yet, but we hope to within a couple of weeks.
Yes, and I believe something we're all concerned about is the impact that COVID has on us as students, as this community, as this state. What is that impact specifically?
We did a survey recently of those students that we identified with COVID-19, as well as those who were asked to quarantine as close contacts. And we found that students are very worried about the impact of COVID-19 on their grades, if they need to access their education remotely. They're concerned about their emotional well-being because their social life is curtailed. But we also found the students are, in general, very happy with the response that USD has put forward to help them access their education and take care of them when they're in quarantine and isolation. So it's a mixed bag. We know what students want, and we're delivering it pretty well, I think, but there's no getting around the fact that COVID-19 does interrupt a person's life.
Absolutely, and here at USD, of course, we are trying to protect the pact. What can further be done to mandate the proper usage of masks within on-campus buildings?
Well, mandating things is difficult. We are relying on the goodwill and the team spirit of all Yotes, not just our students, but also our staff and faculty. This is a voluntary effort to protect each other. My actions affect you, and your actions affect me. If we can sustain that for just 5 or 6 more weeks, we can get through this and come back safely in January, again as a pack. The things we can do in addition to what we're doing now, is to extend our precautions. We wear masks in classrooms. Well, you might consider wearing them outdoors. We wash our hands every half hour. We might wash them every 15 minutes. Do what you've been doing. Just kind of double down on it right now.
Absolutely. And, colder weather means more inside time than what we're going to be used to, what we're having right now. So I think we both can agree that protecting the back is going to be
My advice would be to hang with your people you normally hang with. Try to avoid strangers and new people.
Absolutely. Thank you, Kevin. Any questions or concerns regarding COVID-19, make sure to take those to the COVID-19 task force here at USD. Live in the muck, I'm Sierra Prue.